The most important thing, I think, is in working with the policy unit is actually not bringing expertise yourself, but it's actually knowing who has the expertise and bringing that expertise to play to the questions that are actually important. And I think what's important today is the people with the real expertise in these issues are actually the people who are in the room. And really what I want to do today is give you a taste of the workshops that have been developed to support the physical health, mental health initiative run out of the Mental Health Drug and Alcohol Office. This initiative started very small and continues to grow, and I think that really reflects the growing awareness at multiple levels of the issues around physical health for mental health consumers. And really what I want to do today is to give you a feel for the material that's been presented to mental health workers within the public mental health system, in conjunction with partners and GPs, encouraging them to improve their response to physical health issues to mental health consumers, but also encouraging them to work with others. And what I'd like you to do today is to think about what the opportunities this brings to you, and what awareness, how that awareness helps you to know how to engage with both the issues you'd like to see addressed individually, or for people you know individually, or at a systems level. So really this material is the same material that is being used in those workshops. And if I don't get to the end of it, I'm not worried, because the issue is really for you to get an idea about how to engage with clinicians. So the initiative was launched in May 2009, and the broad goals really were to recognise the link between physical and mental health, which sounds obvious now, but actually in 2009, even though it was well known, it was something that really needed to be brought out and highlighted to people. To support a holistic approach to healthcare and to mental health care, and to encourage greater collaboration between stakeholders was a key goal from the start of the initiative. And the specific aim then was to actually improve the physical health of people with mental illness, of the guidelines and policy directive. And really the goals of that were to clarify and promote responsibility for services to provide holistic care. So making it clear that within mental health services, whilst the provision of mental health care is really important, it's also really important to be looking at the bigger picture. And also acknowledging the importance of working collaboratively with other healthcare providers. This is what happens when you use someone else's slides. And really the training and the workshops which these slides are based around is really based on those documents. And so if you were to go to the New South Wales website, and I'd recommend using Google if you want to find something on the New South Wales website, you can find these documents, the policy and guidelines that these are based on that website. So what I'm going to do now is quickly go over some of the things which most people in this room would be very well aware of. The evidence is very clear that people with mental illness have got poor physical health. They do have significantly reduced life expectancy, reduced access to healthcare, and they don't always, but they may receive insufficient medical assessment and treatment. And so the questions are, what can we do to improve health outcomes? And the focus of the workshops is a collaborative approach, an approach that is encouraging regular health checks for consumers with mental illness, with understanding what are the priorities. There's multiple things you could consider, but actually where are the main things we need to be getting right all the time, and what are the things we can do within services to improve our capacity to do that. Within the guidelines and within the workshops, the underlying principles that guide those are of quality and evidence-based care and treatment, taking a respectful and non-judgmental approach that's culturally sensitive, to consider physical health in care and planning for mental health interventions, to collaborate with other health providers, particularly GPs, and to include access to health promotion, screening and preventative activities to people with mental illness, so whether that is within the mental health service or within the community. So emphasising that people, just because someone has got a mental illness doesn't mean that they should be excluded from those activities, which unfortunately has occurred. and to make sure that we respond to the needs of different people from different backgrounds, different ages, and try to make that irrespective of their English proficiency. The first thing that's emphasised is the importance of regular health checks. So the goal for that is to reduce misdiagnosis, to bring in treatment earlier, to make sure that when we do use medication it is better tailored to the person's needs. It's not just their mental health needs but their physical needs as well, and to provide access to preventative interventions. So if we look at, there's multiple things we could look at, what are actually the priorities if we look at the evidence? And really the priorities are around cardiac and metabolic disease. There are many other issues that are important, but if we look at what are the big problems, it is there. And particularly it's a big problem because we know it is where the interface with medications that are used for psychiatric illness can have a particular effect. So the sorts of things that need to be considered are, as we've already started to be discussed, obesity, diabetes, hypertension, smoking, lack of regular exercise, and high cholesterol, high lipids. And you'll notice that the same things that are important for the rest of the population. And really, that is the message. The message is, it isn't something special that people with mental illness need. What they need is the same access to care as everyone else in the community. There's also, you can look at other cardiac risk factors, such as dental disease, which is very common but often overlooked in terms of people with mental illness and the community in general. And the metabolic syndrome, where you have parts of those things come together to particularly put people at high risk. As I said, dental disease is often overlooked, and so it's one thing that's emphasised in the workshops is people do need to be considering about is a person's risk of atherosclerosis because they've got dental disease actually being addressed, and do people with mental illness have access to dental care. The metabolic syndrome is looked at in some detail in the workshops, and the reason for that is because of the risks that it has for the person's health and because it can be affected by medications, particularly medications for schizophrenia and some of the medications for bipolar disorder. And really, when you hear the term metabolic syndrome, what it's referring to is a combination of having raised triglycerides, so one of the bad fats in the blood, having lower levels of the good fats in the blood, as well as having raised blood pressure, increased glucose when it's fasting, so whether it's diabetes or at risk of diabetes, and having central obesity. The guidelines try to emphasise, though, that whilst metabolic health is really important, that we need to look beyond that as well. And there's a whole range of issues that need to be considered. And it really depends on the individual consumer and their circumstances, coming from an older person's perspective, also their age, about which issues may be most important for individuals. And they may include their eyesight, hearing, the issues of cancer and early detection of cancer are a particularly important one, the side effects of treatment, asthma, and then bringing it together, the question was raised about how do you keep, getting weight off is one thing, but keeping weight off is another issue again. And really, the issue of healthy lifestyle, which is a difficult one for everyone, is really a core issue. And then preventative health management. What are the things that everyone should be doing trying to prevent illness starting rather than having to treat illness? So the guidelines go into some details about what is expected within health services in terms of the initial physical examination. And I think the major changes there in terms of previously is it does emphasise the importance of actually finding out the person's height, their weight and the degree of central obesity they have, so you can look at how important it is to emphasise particular aspects of physical health care. The guidelines then provide a list of investigations that may be appropriate on admission to mental health care. And it doesn't dictate to clinicians, you must provide, or you must do these investigations. You don't want to do a bank of investigations just for the sake of doing them, but ask them to consider whether these things are required. The guidelines also provide information for clinicians about, and the workshops go into, how to provide examination for movement disorders that can be associated with mostly the older antipsychotic medications but which also can happen for anyone in the community, and unfortunately people who are both older and people who have mental illness, irrespective of having what medication they're on, are at higher risk of some disorders in terms of movements that happen which can't be controlled. And so this provides clinicians with a systematic way of looking at those to see if they change over time. And again, coming back to the issue of, does that affect the way medication should be used, and how does that affect their physical health? The guidelines, they do move on from where do you start when someone comes into the mental health system, and look at what are the ongoing physical health issues that need to be considered. Because we know some people do move in and out of the mental health system, other people come into the mental health system and then remain within it for some time. And so this is really focusing on those people who do remain within the mental health system, and to think about what are the issues that should be addressed. And again, they're very similar to the rest of the population. So it's smoking cessation, it's weight control, regular exercise, monitoring blood pressure and organising dental reviews as the highest priority. And then considering other issues that may need to be addressed, such as sexual safety advice, visual and hearing examinations, self-examination for cancers, flu vaccines, and education on drug and alcohol risks. And importantly, there's no point in doing those things within care, be it inpatient care or be care in the community, unless when the person leaves the system, you then communicate that and ensure those strategies are continued. Most commonly, if they're medically orientated, that would then be by the GP, but obviously there's the importance of family, there's the importance of non-government organisations, and what is emphasised is that those things have to be emphasised on discharge and transfer of care. Discharge documentation, discharge communication shouldn't just be about mental health issues. It should be about the overall needs of the person. The guidelines then do take the line of saying these are the minimum things you need to do. They're not saying you should not be doing more than that, but they should be saying all services should be aiming to do at least this much. And so that all services should know how to respond to medical emergencies. It might sound obvious. Most services were doing that already, but it's important to be very clear that that baseline exists. All services should be including physical activities in their rehabilitation and recovery programs. There should be clear protocols to ensure that the ongoing physical health needs of consumers are being met. They're not dependent on the individual clinician that you're in contact with. And that all services should be improving their partnerships with general practitioners and ensuring that the care plans they have address physical health needs in collaboration with the person's GP. Again, going back to basics, the initiative was about ensuring that all inpatient and community services have got access to the equipment they need to actually provide the physical health care. And that clinicians are very clear about the need for a physical examination when a person first enters care, and that examination will need repeating if the person stays in care. That just the person's mental health doesn't stay the same, the person's physical health will change with time. And in community care, whilst the time frames aren't as urgent as they are in inpatient care, it's just as important to be considering those same things in community care. The difference in community care from a mental health service provider perspective is that often the physical health care actually will be occurring through someone else. And so the real importance is about partnerships. And I think the really important thing for me today is that people here are thinking about what is their role in partnership with mental health services in improving the physical health care for consumers. Because each of you are a partner. And so everyone here's got a role, and it doesn't matter whether they are a consumer, family member, professional within any sort of organisation, we all have got a role to play in improving the physical health care for mental health consumers. And so in the workshops, there's then time put aside to actually discuss how to develop those partnerships. And in the workshops, in many ways, the key issue is actually for people who are on the ground to have a chance to come together and to talk about how do we work together. What are the things which we might have to overcome? There's concerns about confidentiality, concerns about how do we set up communication that works effectively, how do we develop networks? So this isn't we come together for one workshop, it's a great idea, and then everything vanishes when we go back out into work and we find that there's other things which are pressing priorities today. So the workshops are aiming at trying to get people to think about how do we sustain our effort to improve the physical health care for people. And the workshops try to go into very practical things. What are the Medicare rebates that are needed or can be used to encourage GPs to improve the physical health care of people with mental health disorders? And then to look at what are the things that mental health services can do directly with consumers to try to assist them with their physical health care. So that might be providing direct information such as about their physical health diagnosis, treatment options, how may their medications interact with their physical health condition, or it might be providing support to do some of those things, providing support to help make health appointments, link consumers with GP, link consumers with other organisations. Now what you can see with those things is those things aren't things which only can be done by mental health services. They're things which mostly won't be done by mental health services, but is saying that mental health services have got a part to play within that and should be ensuring those things do occur. And so the key issue is actually looking at that there are different stakeholders who have got different roles to play in this area. So looking at carers and families, looking at the fact that their role is formally recognised and encouraging mental health professionals to remember the role for carers and families and ensuring they're communicating both as is expected formally under the Mental Health Act, but also as is just should happen as part of good practice. The role of NGOs, and so encouraging mental health services to work with NGOs to ensure those range of complementary interventions, which you're going to hear a lot about today, actually do occur, and how do mental health services work with you to ensure those things work in a way that works together and it isn't feeling for a consumer that there are different parts of the system that just don't come together at all. And also not forgetting private specialists and allied health professionals and how both for NGOs, for families and for mental health services, how they work together. So in summary, the guidelines and policies really were a starting place. A starting place to help specialist mental health services recognise their role in physical health care of consumers, to clarify the linkages they need to develop with other providers, and to encourage stronger partnership with key stakeholders, as well as putting in place those minimum expectations around standards, with really the goal of improving the physical health care of mental health professionals, of mental health consumers, and hopefully professionals.